So very welcome, everybody. I am Dr. Merl Salinas at Lincoln University, and we have from Virginia Tech Dr. Jimmy Stewart, where she will be now talking about the bug, the RAM, how to manage it. And with us is Dr. Acharya, also Extension State Specialist here at Lincoln University, and Jennifer Lutz, that she is our invited partner from Missouri Extension University. So she is great in economics and the management of small dominants. So we are going to give the time to Dr. Stewart. So go ahead, please.
Okay, well, thank you again for having me, and thank you for everybody that is showing up. I do have the closed captioning working this time, so
Okay,
hopefully you guys can see that. And hopefully it's not blocking too much of the screen, but if there's any issues, let me know and I can turn it off.
okay, thank you.
Okay, so we've talked before about I covered a little bit of the anatomy, both male and female anatomy and physiology, and then I moved into a lot of the management on the female side. So we're going to talk a little bit more about the male side today, so which includes mostly natural breeding. So that's mostly what we're going to cover kind of in this discussion, whereas in the female discussion we talked both about when you would use natural breeding versus artificial insemination. So when we use natural breeding, it's going to be a lot of times for our meat and fiber production systems. I believe we talked about in the last one that when we do artificial insemination, that's what we're using a lot when we're focused more on improving genetics, selecting for certain traits, and smaller farms that maybe don't want to keep a male on site. And when anytime we're trying to plan to do natural breeding, we want to make sure that we're always starting with when do we want the animals to be lambing or kidding? So when do we want them to be giving birth? And then we're going to work backwards. And then we have to also keep in mind that how long the male is going to be in with the female. It's not just we put them in right when they're in heat and pull them out, although you can do that. But for the most part, you're going to want to keep him in there for about a cycle and a half, which is going to be 30 days. Some people will do a little bit more than that to make sure that maybe he can breed 2 or 3 cycles and have those opportunities to breed. And we'll want to also focus on what is our male to female ratio going to be when we're doing natural insemination. And so that's going to vary based on the age of the male, with a little bit of emphasis on what his scrotal circumference is, the size of our mating area, and whether or not we're synchronizing the females. So we talked about in the previous one using a double lutealize so that all the females can be bred within a few day period of each other so that we can plan better for when they're going to be giving birth over, maybe a 3 to 5 day period. And so if we've got our young males, we're going to have about a 1 male to 20 to 25 female ratio. So, and that's just because they're younger, their capacity to produce sperm is less. When we get to the adults, it's going to vary a little bit. So if we're in kind of a confined area, you can push it really hard, 1 to 40 or 50 females. I've heard people even pushing it as far as 1 male to 100 females, which if he's a big guy and has a good scrotal circumference and has always done well with that, there's no problem with that. You just might risk having a little bit of more spread out birthing rates if you're leaving him in there longer, if he can't get all of them in the first heat. If you're in a range situation, it's recommended to cut that down because he's going to have farther to travel to get to the females, so he might miss some of them in estrus on that first heat if there's too many in there. So in a range situation, we're going to say about 1 male to 25 to 30 females. And if you're synchronizing the females, again, doing like a double lutealize so you can get that condensed period, you're going to have to really cut it down because he just physiologically can't get to 50 females all within a 3-day period. So that's going to be one male per 15 to 20 females. And then when we're out of season, and we talked about this in the anatomy lecture where testosterone goes down, their capacity to produce sperm decreases, you're going to want to, and most of the time the females are going to be synchronized because it's out of season. We're going to cut that down to one male per 5 to 10 females. So you really lose a lot of capacity when you're breeding them out of season. And we talked a little bit about photoperiod manipulation in the previous talk, and you can maybe push that back up to this 15 to 20 if you've had him under lights with the females, if that's what you've been doing. So it's just going to depend a little bit on the male and how he responds. And then it's useful to, when anytime you're doing natural breeding, is to have markers on the males. And as a veterinarian, I always find that useful if we're seeing females towards late gestation because it helps give us an idea of when they were bred so we know what their gestation, where they are in gestation, if we need to make decisions for parturition induction, things like that when they're sick in that late gestation period. And it also helps if you're trying to track the female cycles too, to see if they're cycling more frequently than what they should be also. When we're using natural breeding, male reproductive soundness is the most important factor to consider. And I'm going to touch more on that in a little bit. So this is just a review. So I went through this before in the anatomy section, but just remembering that the males, they've got vesicular glands, which is a site where they can have some disease develop. And so once they produce semen, it goes into the epididymis and then it goes up to our little ductus deferens and then it enters the urethra. And so that's where we're seeing it right here in this picture. And at that point, it combines with seminal plasma that's produced from these seminal vesicles, these ampulla, which is a swelling around the area of the ductus deferens, and then the prostate is within this area too. All of that's contributing to that ejaculate that's coming out. And then basically the urethra travels all the way down here until where it eventually comes out through the glans penis. And focusing on with the male that we do have this urethral process that's a normal part of their architecture, but if you've had one that got blocked and had to get cut off, they can still naturally breed normally. Okay, so when do we want to do a breeding soundness exam? The most important time to do it is before a breeding season. And this is just to make sure that there's no underlying issues that's going to cause you to have a bad season, especially if you've got one male that's responsible for breeding females. There's no backup in there. So if he is not fertile, not producing good sperm, then your bottom line of getting females pregnant is going to be affected by that. The other time we might do it is before selling them. You might have a buyer that's requested a breeding soundness exam be performed. And this is important if you're working with a veterinarian to do this, that you let them know, because a lot of times, especially if it's out of state, if you're crossing state lines, there's a lot of other things that you'll need, and the veterinarian can better prepare for it if they're coming out to your farm to do this, if we know ahead of time what you need. Where you're going. So certain states have certain testing requirements, and we can plan for making sure that we have all of those boxes checked when we come out there. And then the other time that we'll perform, and hopefully not, is after any type of breeding issue. So females have continuously come back into heat, if we've gone out to do pregnancy checks and the pregnancy rates are really low or there's no one pregnant. And this is what we would consider more of a diagnostic exam, because the male obviously has something going on if none of the females are getting pregnant. So we're going to spend a little bit more time. We might use things like ultrasonography as part of our exam. We might opt to do some cytology of the ejaculate if we're even able to get anything. So there's other things that we might do at that time that we might not do at any of the other exams. And so just to kind of highlight the importance of it, so this is a true story of a client that we had, that my colleague went out to do some preg checks and found 50. So they brought this guy, put him out with the females directly, didn't have a breeding soundness exam performed, and put him out with 50 females. And 100% of those females came open. And if you think about it, we're doing the preg checks probably somewhere around 40 or 50 days after the last potential exposure. So if he was out there for 30 days, so now we've got a lot of wasted time and we might be getting out of season. I think these were actually out of season now by the time we got around to doing the preg checks. And so they brought the male into us and you might not be able to appreciate it as much, but basically his testicles were really high up against his body. It took both of my hands to be able to hold it down. And then I had somebody else come in with the scrotal circumference tape to do a measurement of it. And it was, if I remember correctly, it was somewhere around 24 centimeters. So his scrotal circumference size was really small. His anatomy was such that he was holding them up really high, which was probably affecting thermoregulation. And we did make an attempt to collect semen, and he didn't produce anything for us when we attempted to collect. So come to find out there were some underlying issues with him that a simple breeding soundness exam before the season, which would have taken, usually no more than about 20 minutes to do it on a single animal, would have prevented a really detrimental effect that this had on the herd that year. And this was just kind of a joke amongst me and my colleagues because his scrotal circumference was about 24. And at one point we got these, I don't know if you guys know what truck nuts are, but it's just something that you can hang on the hitch of your car that's supposed to be really funny. And one of my colleagues had bought one to use for some kind of teaching thing. She wanted it as part of a model. And we had taken a scrotal circumference of it just to see it was. So we were just teasing that this guy's scrotal circumference was less than that of the truck nuts. So I always just put that in there because it just kind of adds a little bit of humor to an otherwise pretty sad situation. But a situation where we, found a lot of information. Okay, so we've got a poll question coming up.
You say the first question?
Yes.
Okay.
Okay, so hopefully, based on the story I just told you, everybody should get this one right. When is the best time to have a breeding soundness exam performed on your male?
Yeah, very fast answers. Yeah.
Mhm.
Okay. Do you want to give feedback?
Yeah, so looks like most everybody got that shortly before the breeding season, and I put that kind of vaguely because, if you do it 2 weeks before the breeding season or a month before the breeding season, it's going to vary based on if your ability to find a replacement. If you don't have a replacement that's readily available, then you'll probably want to do it about a month before the breeding season to give yourself time to find another one. If you've got several rams to choose from and you have to kick one out and it's not going to be that big of a deal, then you can do it right before you turn them out. You could do them a week before. So that's always an option too. So that's why I kind of left that one vague. 2 weeks into the breeding season wouldn't be the worst thing, but most people don't really want to, once they've started breeding, pull the male out then. That's just usually not the best thing to do right in the middle of the breeding season. At the end of the breeding season, again, that ideally we're not doing it then, because if we are, that means that there was a problem. And then obviously this last one's not correct because breeding soundness exams do have a lot of necessity. Okay. All right. All right, so now we've got to the when is it done and why is it done? Now, what exactly are we doing as part of a breeding soundness exam? And I'll preface this with there are a lot of people out there that just go around and do generic semen testing, so non-veterinarians that go around and they can collect a buck or a ram and they can put it in a semen analyzer, and most of them will read out a motility and let you know that he's good to go or not good to go. And I'll argue that having your veterinarian coming out and doing a comprehensive breeding soundness exam is going to be far superior to that. You might pay a little bit more, but you're going to get a lot more information as to whether, regardless if the semen is alive or dead. Obviously, we're looking at that too, but there's a lot more information that you'll get from having a veterinarian out. And so what we do is we typically do kind of a quick general physical exam, then we do a focused reproductive exam, and then we analyze the semen. So there's several different parts to it. And the only thing that's truly missing when we do it, and most of the time this is because we're doing this with a process called electroejaculation, is getting an assessment of libido, which just means their willingness to mate, which is easy for you to assess when you're at home, by putting a marker on or just going out and watching them. You're just checking to make sure that he's able and willing to go around and mate. But we're just, basically looking at him and saying, does he have all the machinery to get it done? And there is a test if you do have any concerns, there is a specific test you can set up called the serving capacity test that will measure how often a male is going to service a female in a defined period. So you set them up in a pen that's in clear view of the males to be tested. So and you're going to put some cycling unrestrained females in a pen, and then you're going to place a male in there with them for about 20 to 40 minutes. And he should hopefully, again, she should be in heat, and he should try to get about 4 or 6 or more breeding during that 30-minute period to be ideal, but even 2 to 3 is going to be acceptable. And if he doesn't pass on the first one, you can always try it a second time, or you can leave him in overnight with a marker, and that will give you an idea. And so there are ways to do that, test that libido without having to do it as part of the breeding soundness exam. It's usually not necessary to do it right away unless there's known problems. So moving on and talking about these components individually. So we look at a lot at the body condition score, which I've talked about with the female, but I'll talk about that a little bit. I'll show that a little bit more on the next slide. We do like to always check their FAMACHA score because that's just a good part of any small ruminant examination. Because if they've got a heavy parasite burden, they might be not, they might be ill and not willing or able to get around and service the females just because they might become weak. So we want to make sure that their FAMACHA score looks good. They don't need any deworming going into the breeding season. So, we always like that to be about a 1 to 3 out of 5. 3 is going to be kind of our borderline there, that if he's got other issues, if he's a low body condition, if he's got poor fecal score, then we'll do the 3s. But if he's otherwise in good health and he's a 3, we don't necessarily always deworm based off of that. And then obviously just making sure there's no other obvious signs of illness, no fever, he's not lethargic, he's not actively sneezing and having really bad discharge, because again, if he's not feeling well, he's not going to want to go breed females. And one that we always have to pay special attention to is the eyes. We want to make sure that they're visual, and that's really important in our males when we're doing natural cover, is because the females are going to be showing signs to the male that they're in heat, and the male needs to be able to see those and detect those to know that it's safe to approach the female, that she's receptive. And then obviously that goes along with our leg and our hoof health, making sure that we've got good hoof conformation, everybody's all trimmed up, because now once he's seen that the females are in heat, now he needs to be able to get to them. And especially if you're in a pasture situation, he might have to move around a whole heck of a lot. So you need to make sure that he's going to be able to do that. And if he's lame, he's not going to be able to breed quite as many females because he just physically can't get around to them. So focusing more on this body condition. So we want them to enter the breeding season what I call well fleshed. So somewhere between a 3 to 4 body condition score on a 5. So we obviously don't want to start off as a 4 to 5 and that's what I'm talking about down here with the over conditioning, because that can slow them down. That can predispose them to things like arthritis. They can also deposit fat around the scrotal cord, and it can affect their spermatogenesis. Whereas if they're somewhere between a 1 to 3, they are going to lose their condition during the breeding season because they become so focused on breeding, especially if you have a lot of females for them to cover. They're going to be very hyper focused on breeding that their voluntary feed intake tends to go down. And so if we've got them somewhere, obviously if they're going in as a 1, that's definitely a problem because they already don't have enough energy to breed. But if they're going in somewhere between, somewhere around a 2, they're not going to be well fleshed enough to support themselves while they're breeding. So somewhere between a 3 and 4 is ideal, just to make sure that they've got a little bit extra to maintain them. And so if you're trying to prep them going into the season, you really want to start upping their energy protein supplement about 4 to 6 weeks before breeding. So, and this is just from some references that I've had that say about 6 to 8 pounds of forage and 1 to 2 pounds of a 12 to 14% crude protein concentrate is usually good to support that goal of trying to bulk them up before the breeding season. And then equally important is after the breeding season is to make sure you check their body condition. And if they have dropped down to to a 2, then you might need to help supplement them for a little while before letting them go rest on pasture for the summer. So you might have to help bulk them back up if they did lose a lot, especially if it was a long breeding season. And I think I might have put this one on the last one, but these are just a couple of the body conditions score charts that I like. And like I said, I'll share this, and I've got the link for this. But just especially looking at the back end, we always want to make sure that they've got that we've got kind of a little bit of a raised appearance back here in the rump. And with the females, I always said don't let them get to a 4, but again, going into the breeding season, it's okay for a male to get upwards to a 4, but not anywhere between a 4 and 5. You don't want to get beyond that, so where they're just obese, and it's gonna, like I said, it'll affect their motility. Okay, so I've got another poll question.
Okay, let's go for question 2.
All right. When planning nutrition for your rams and bucks, what considerations should be made? So this might take a little bit longer because there's a little bit to read there.
Okay, I guess I will stop the the poll and
Okay.
check the results.
Yeah, so again, it looks like the majority of everybody is paying attention that we want them slightly on the heftier side at the beginning of the season. So obviously we don't want them at a marginal condition. It won't help to promote spermatogenesis. In fact, it might actually hurt it. And while it, might minimize the risk of developing hoof and joint problems. So if you get them, at no more than a 4, then you should still be good against that. So those are all good considerations to make.
We have very smart farmers.
All right. All right. So the next thing after we've gone through our general physical exam is part of our focused reproductive exam, where we basically hone in on the reproductive organs. So first thing is obviously make sure there are 2 testicles that are fully distended. So these are the cryptorchids over here that only have one descended. And then once we do have those 2, we always want to make sure we palpate them to assess tone. We're feeling for symmetry to make sure one's not larger than the other, and temperature, make sure they don't feel too hot, too cold. And then for their tone, so one of my mentors used to always say a mango the day before it's ready to be eaten. I have another one that says a hard-boiled egg. So somewhere in that range of, not very hard, but also not very soft. And then also with a good focus on the epididymides, which is the structure that's especially the tail, which is a structure at the really farthest end of the testicle down there. This is where the sperm is stored right before ejaculation. After it's been produced in the testicle, it just kind of stops here until ejaculation occurs. And this is where most of the disease tends to occur in our small ruminants. So we want to make sure that we're focusing on that to make sure it's normal. And then always measuring a scrotal circumference. And so this is just a picture I have that I feel like does a really good job at giving you a good difference of one that has an appropriate tone where you can see it. And this is how we measure the scrotal circumference right here, is putting this tape around here. And you can just you can just feel it from the picture. That is a nice kind of turgid in appearance. Down here, you can see the prominent caudal epididymis or tail of the epididymis, but they're a normal size and they palpate normally. One's not larger than the other. Whereas over on this side, you can see this look pretty small, and they just look soft in appearance, I think, in the picture, and they were just kind of mushy. And so this is telling us that spermatogenesis is probably not occurring very well in them, and there's something that's causing testicular degeneration, which this guy was really sick, and that was part of his issue. So looking at scrotal asymmetry, it's more than just looking at it. So this was a case that I had when I was a resident at Illinois. And I remember the students coming up to me and they're like, oh yeah, so we're looking at him from behind. So this is the left testicle over here. This is the right testicle. And I remember the students coming up and saying, oh yeah, his right testicle is so much bigger than the left testicle. This is crazy. You're going to have to come feel. And so I come feel, and what I found was completely different from what they found. The testicles were actually equal on both sides, but then what I could feel was his epididymis. And so here's his caudal epididymis is all down here and then all over here. And for both sides, it was enlarged, whereas the testicles were small and actually really quite soft and degenerated, whereas this was filled with purulent material and had a raging and epididymitis. So anytime we see any of that, obviously there's an issue, but it's just kind of raising the importance of when we're trying to figure out what exactly is going on is, making sure we know what we're feeling. So I always emphasize that to students. And when we're measuring scrotal circumference measurements, it's very species and breed specific. So, and there are seasonal fluctuations. So out of season, we can see it decline upwards of 30%. So I don't place a whole lot of emphasis on the hard and fast number as much as the individual animal, his breed, and how they palpate. So tone and symmetry wise, I tend to emphasize more of that and where we're at in the season and looking at those trends. So, and then just trying to see, if this is his normal size coming into the breeding season, then I'm not too concerned about it if it's kind of a borderline size. But we do have some measurements out there for both rams and bucks kind of as guidelines. And with rams, we've got a little bit better basis of numbers than what we do for bucks, just from past data that we have. And the testicular diameter at 170 days of age does provide a good long range prediction of what their testicular size and sperm output is going to be post puberty. So when we are doing ram lambs, especially ones that are at least over 150 pounds, we want them to be at least 30 centimeters. And then yearling rams that are about 12 to 18 months, we want them greater than 33. And then once they reach that mature age, we usually want them at around 36. And those are kind of the ideals. And then this is just another chart that kind of puts them into more of a questionable, satisfactory, and exceptional. So where you can see like most of these ones are kind of our exceptional parameters. So for our young guys that, again, these kind of fall into our yearling ones, 36 is going to be great for a yearling. But anything 28 to 36 is considered satisfactory. And then we say questionable and not necessarily failing, because again, if he's servicing females well and doing okay and everything that palpates, if he's right at a 28, I probably won't fault him, though. I will, put questionable on there and tell the owners kind of my concerns about it, especially if he's got a lot of females to breed. And then again, for older than 14 months, you see this one on this chart, it comes as larger than 40 is exceptional, and then 32 to 40 is satisfactory. So a little bit different for the older ones than this was just a different chart on here just to show kind of a comparison. And then for bucks, we have even less standards. Bulls, we have very set standards. Rams, like I showed you, some set, but kind of questionable standards. So I tend to just say anything that's greater than 25 centimeter is acceptable. And then I go off of, again, palpation of that individual animal. And then this was from one chart that showed for kind of your smaller dairy breeds, again, a minimum of 25 there for them. When you get to your bigger ones, you'll find that most of them are going to be about 34 to 36 centimeters. And then again, when you get to your younger ones, kind of in that 26 to 29. So again, I kind of use 25 as my cutoff there since it's so close to that. And then this is just showing, this was an article where some of this has been derived from, showing this is the age in months. So get up to as you get up to about where are we at, a year right here, they're going to be about 19 to 23. When they get up over to about 15 months, it's going to be about 23. So you can see that the bucks tend, and with the big thing is that the bucks tend to run a little bit smaller than our sheep anyways. So we have a little bit more flex guidelines. And why do we want to focus on size at all? It's because the scrotal circumference is correlated with the testicular volume, and the more testicular volume we have means that we have more of these little seminiferous tubules in here. So this is within the testicle, and these are directly what are producing sperm. So they're kicked into the lumen, and then they are moved to the rete testes, which then move it to the epididymis, which come down here to that tail that's down there, and that stores it until it's ready to ejaculate. So the more of these, the more volume you have, the more of these little testicular or sperm making factories you have, the more likely that they're going to be able to produce sperm, and they're going to have more cells that produce testosterone. So those are the Leydig cells that produce testosterone. So you're going to have higher testosterone too. And so some of you, if you ever have worked with bulls, know that we usually perform transrectal ultrasound and assess their accessory sex glands. And we can't really do that in small ruminants because of their size. So if we do need to do it, it usually requires using transrectal ultrasonography. So this tends to be something I do more on a diagnostic type of exam and not routinely. And luckily with small ruminants, they don't tend to get a lot of tend to get a lot of disease within the vesicular gland, and if they do, it's usually associated with having an epididymitis. So and which is pretty easy to find just on physical exam. So there's not a lot of times that we'll find vesiculitis without some other issue. Or if I'm doing a breeding soundness exam and they don't pass, but I see a lot of white blood cells, then that might give me an indication to go ahead and do an ultrasound. And this is showing a normal vesicular gland right here, and then this is one that we diagnosed with vesiculitis. So it's just a little bit, you can tell it's a little darker in appearance. It's got like these little spots of black, which show that it has some fluid inside of it. It's distended and full of fluid. Okay, then the next thing that we're going to do is examine the penis and the prepuce. So typically we'll try to do this when we're collecting the semen because it will actually come out and we can look at it. But if it doesn't, we can take him after the exam and manually exteriorize it just to make sure that it can come out normally, it's not getting stuck, and that everything looks normal. So this is a pretty normal looking one right here. Again, he's got that urethral process, and it's pink and healthy in appearance, and his prepuce looks normal. There's no lumps or bumps or anything on it. All right, to do our semen collection. So there's two different ways. So, you might have someone that asks you to synchronize some females. So you have some in estrus and you can collect them by AV. But I would say most veterinarians probably are comfortable enough with just doing electroejaculation, and it's a quick and easy way to get semen from them. So with rams, I tend to use this nice little handheld electroejaculator, and it just puts we put it in the rectum, and it puts a little mild stimulus on those accessory sex glands right there, which just forces him to ejaculate. And so we can collect that. It usually takes no more than a minute or two to get a sample. With the goats, the box I don't feel like is gentle enough for the goats. They're a little more gentle of creatures than our sheep. So this is just a little box unit that we use for our bulls. So I connect it to we've got a small ruminant probe that connects to this box, and I can manually control the stimulations that are applied so I can make it a little bit more gentle for our little rams to be collected. And again, they tend to do just fine. We had this guy on a milking stand, and they tend to, some of them will vocalize more than but otherwise they tolerate it quite well. So once we get an ejaculate, we always kind of look at the sample itself immediately to look at the color and consistency. So it should kind of be a little bit of milky in appearance here. So sometimes it might have a little bit of a yellow tinge to it, which is fine. But sometimes this was a deer that we collected, a white-tailed deer that was we were kind of right at the edge of the season. And so he actually had some really small vesicular glands, and we think that he had a little bit of blood being produced from those vesicular glands that were just degenerating. And then evidence of infection too. So sometimes on this one that we can see, there's some kind of sediment looking at the bottom. And I believe when we looked at it, all you could see was a whole bunch of little white blood cells. So that's these little circular cells that's within this microscopic image. So these are all the little sticks looking around it are all the sperm cells were kind of zoomed out, but then we had a lot of these white blood cells in there indicating that there might be some infection. So those are kind of the initial things that we look at, and then we look at it under the microscope. And again, the first thing that we're going to do is motility because that's the first thing that's going to start slowing down. So we want to make sure that we get that right away. And then, like I said, with this one, you can, if you're curious that there might be some infection, if you see some clumping in there, then you can always look for white blood cells initially on that exam too. And this is just a couple ways that we look at motility. So one is we look at mass motility, which is basically just put a drop of that really concentrated sample in there, and we're looking for the swirling pattern. So what we want to see is this nice rapid swirling, and that indicates that usually that the motility is going to be about 70% or higher, which is pretty good. Sometimes you'll get this motility that comes in and it's more just kind of you don't see the swirling pattern. So those are the good ones to dilute out and look at a little bit higher magnification. And so then we can look and see if we can get kind of a progressive motility or looking at how many of those individual sperm cells are moving, but also moving in a straight line. So with ideally, we're wanting to see that at least 30% of those sperm are swimming in a straight line once we've diluted it out and looked at them individually under the microscope. And there are, technologies, and we've been looking at this a lot, especially I've been doing some projects with RAMs of these port automated semen analyzers and see how well they do compared to our benchtop analyzers that most people can't really utilize out in the field. So this one connects to it. This was the iSperm that connects to an iPad. And we just put a little drop of semen on this little, this is basically just a flashlight, and it hooks into this little camera that hooks up to the iPad camera, and then we run an app and it gives us all this information on the motility, but also that progressive motility that I talked about that we want to be at least 30%. And then it gives us certain velocity parameters too, which basically just tell us how fast are the sperm swimming and how fast in a straight line the sperm are swimming, which feeds into that progressive motility. So this is some cool stuff that I think is going to help improve our breeding soundness exams in the field that we do in the future. And we've been doing a lot of studies with this one, and there's another one that connects to the laptop that I have been doing some studies with also. Okay, and then most importantly is getting to the morphology of the semen. So I would argue that this is a much more important exam than just doing the motility. So where we basically dilute out that semen a lot more than what we did previously, and we stain it so that we can look and make sure that the morphology of the sperm, so what the sperm look like, are normal. And so we go through, and these are what we'll see is we'll see sperm cells, and we're going to go through and we're going to count until we have 100 total sperm that we've counted, and we're going to classify them as normal, which, so one like this is normal where we see a nice kind of clean head. You'll see this thickening where this little white mid piece is, and then a tail that's kind of coming off. Most of them will get fixed while they're swimming, so you'll see the tail curl a little bit, which is fine. But then we're also going to classify them for certain defects. So over here, these are tailless heads, so these are considered defects. And then these one are a common one we see that it's what we call a proximal droplet, so that's got that thickening right there, right next to the head. So that's a pretty common defect that we see. So between those and the tailless heads are two of the really common ones we see. So we count those, and we're going to classify them. Are they a head defect? So some of them will have issues on the head. The head morphology might look different. It might be large, might be small. If there's a classification on the mid piece where this proximal droplet classifies at, and tail defects where there's an abnormality specifically on the tail. And basically, all that information not only allows us to determine if the animal passes or not passes his exam, but also it's going to give us an ability to give a prognosis of how likely do we think that he's going to be able to pass in the future. and if he doesn't meet those standards and what the likelihood that it's going to improve or not. So if we see, so a lot of times if I see a lot of these tailless heads and we're kind of coming out of the, coming out of the summer and he hasn't been breeding a lot and I don't see any evidence of disease or anything, and maybe he's got, like a higher percentage than normal of these, but not a crazy amount, then usually we consider that kind of what we would say a rusty load, where it's just been sitting around the epididymis and he just needs to kind of clear out the track and get some new semen flowing. Um, and then these proximal droplets, especially if it's a young peripubertal male, like when we're checking our ram lambs, I'll tend to see a lot of these, and they hold a really good prognosis if you just give them a little bit more time to mature. Whereas there's certain defects that, again, I'll see it, and we'll say it'll be unlikely he'll be able to breed at least in this breeding season, um, if he doesn't meet the standards. So it gives us a lot more information. And just to kind of hone in on that fact is when they looked at when somebody, nobody's done this work in rams, but when they were looking at BSE outcomes in bulls, they looked from almost 3,000 bull BSEs from 2007 to 2017, and they found that the percentage of normal morphology, which you can see here, was significantly more important. So this log worth means, the importance of it in whether or not they passed or failed. So you can see the percent total morphology was by and large the most influential factor, followed by the white blood, the presence of a high white blood cell count. And then, a couple other things, time of year, their age, the circumference, were all, fairly important factors. But this just highlighting that having that morphology exam done, which is when I talk about people that have semen analyses done by the people that are traveling, most of the time they're not going to do a morphology. And it's a very important part of that examination because they can have a lot of times you can see over here motility is really low in this important factor because they can have a completely normal motility and have a terrible morphology. So it's not a ruling out factor. And then, all in all, at the end of all this, we basically come through and we take all of this information together, the motility, the morphology, and the scrotal circumference, and we can tell that if they're going to be excellent, satisfactory, questionable, unsatisfactory. And I'd say the only difference between satisfactory and excellent is an excellent, I would feel comfortable pushing him, if we're doing natural insemination, pushing him to a little bit more to that 1 to 50 ratio, male to female ratio. Whereas a satisfactory, I'd probably, would stay within those recommended guidelines. So that's really the only difference between those. And then questionable, again, if you have less than that, if you're going to try to put him in with less than those females, then, he might do okay with a lower number of females versus if I'm going to put it as unsatisfactory, he's definitely not going to be able to breed this time around. And a questionable might also be one that I'll just say, he's close to passing, but we need to recheck him, in X amount of time based on what the defects are. And, we've got these nice little charts that we can do, multiple males on. And again, if you're selling him, these are really nice things to have to be able to give to the buyer or to keep in your own evaluations. So just as a summary of the BSE, recognizing it's more than just semen testing. So it really is trying to prevent you from having a bad year. So it's a quick and easy exam, usually pretty affordable, just to make sure that everything's in working order. And if they're deferred or what we consider questionable, it doesn't automatically mean that they fail. So especially if they're out of season, it's not uncommon to not pass them out of season and have them come pass once you get closer to that natural season. They just might not be good for out of season breeding. And also it helps to identify pathology early on when it's still treatable or to identify those that need to be culled. So it's just a good way to make sure that we're checking and not bringing any disease into a herd. And like I mentioned at the beginning of this, always work with a vet, especially if the animal is going to be sold, because there's a lot of other requirements that might need to be considered, CVI, disease testing, vaccines that might be recommended. So those are all important things. And then just for the last few minutes, kind of going through some of the common things we might look for as part of this breeding soundness exam, or you as producers can look for as we go through. So one, and this is going to be your young ones, looking, especially your goats, for polled intersex conditions. So the majority of these are going to be your male pseudo hermaphrodites, and we're going to see this in our polled dairy goat breeds, a little more overrepresented. And the affected animals are homozygous for the polled traits, so we always recommend, if you don't want to get these, is to avoid using phenotypically polled bucks, because it's going to increase your likelihood that you're going to get some of these. And they tend to be karyotypically female, but will develop a masculine appearance at puberty. A lot of times I'll see these before puberty, where again, you can see this anogenital distance is pretty decreased. And he's got kind of a little penis there, but he's peeing out of a hole down here. I've seen ones that have a little bit of a pouch right here. And nothing particularly wrong with them. They're just not, obviously not going to be able to be bred. But they can make okay pets, or you can still cull them if you're doing a production system. Cryptorchidism, I mentioned earlier, usually just having one, most of the time, one testicle that doesn't descend into the scrotum. And we do see a higher incident in our intersex animals, and it is a heritable trait. So we do not recommend breeding those animals. So we do recommend just having a full castration done, which usually requires abdominal surgery to find that testicle that's in the abdomen. We definitely do not recommend castrating just the descended testicle, because he can still be fertile with a testicle in his abdomen, and that testicle in the abdomen is also going to put him at a risk for getting cancer, especially if a lot of these guys I feel like we see end up as pets. So we don't want to leave that in there, and he's going to start acting like a buck. I've seen some before that were supposedly castrated, and we, did a little bit of searching and found out that there was a testicle left inside. So always better to just remove it when you know it's there, so it's easier to plan for and do the surgery. Scrotal hernia, we see this a lot more in rams. There is a heritable component, so if there's no traumatic incident that incited it, so he didn't get kicked or anything, and it just developed, we usually recommend culling those. So you can castrate them, so you can just see it's just kind of usually a pretty soft swelling in the scrotal neck that we feel. And especially if you like put them on your rump and you press on it, it tends to go back in. So it's pretty easy to diagnose, but to get rid of it, like usually have to castrate him and then get in there and close that inguinal ring. So you can still raise them up to, if you're trying to get him to slaughter or again be a pet, but you're usually going to have to require castration. I have had some that were traumatic that we did a hemi castration on. So we basically just took the side out that was affected, closed it in inguinal ring, and he did go on to be a breeder. So that's always an option too, if we don't think it was heritable. So phimosis or paraphimosis, so basically anything that's causing the penis to be unable to come out or in. And so a lot of different causes, so hair ring, trauma, infection. So abelanoposthitis is essentially infection of the penis and that prepuce. Any kind of masses, so this is a big this is a penis right here, and this was a big mass. And so he had paraphimosis, or he had phimosis, where he was unable to get that penis out. And when we pulled it out, sedated him, pulled it out, that's what we found. Trauma, any kind of congenital abnormality, so something we call a persistent frenulum. So that one can actually be fixed for him to be able to breed, whereas some of the stuff, antibiotics might, if it's just an infection, so things like that. So basically to treat it, we have to figure out what's going on and what's causing it to determine if it can be treated and how. Urolithiasis, I mentioned this earlier. So males can breed without the urethral process. So here's one that's kind of distended. It's got some crystals in there, so you can cut that off and they can usually breed. But even with just cutting them off and starting them on urine acidifiers, you're still going to have issues with them potentially becoming reobstructed. And I found that the longer that you mess around with medically treating these, the more likely they're going to get strictures and have some more long-term issues. So if it's a really valuable breeding animal, if they get completely obstructed, we usually recommend having him go to surgery right away to make sure that he doesn't get any strictures within that urethra that will prevent him from being able to breed in the future. If the medical management, if he's only partially obstructed, then I'd say usually it's okay to try medical management first. But if at any time he becomes completely obstructed, be prepared to have to go to surgery for that. Pizzle rot's another one. So this is an inflammatory condition of the penis, prepuce, and sheath. males are usually pretty reluctant to breed, and it's associated with high protein diets. So we tend to see this when we're kind of preparing them coming into season, where they basically are going to start producing more urea in the urine because of that high protein diet, and it interacts with Corynebacterium renale, which is a bacteria that's present in that area, and it produces ammonia, which damages the surface. So these are pretty easy to manage. You just kind of have to pull them off of that diet, shave that area, apply antibiotic ointments, and manage the pain with some NSAIDs. So identifying this early can be really helpful so that you don't have to, lose him for the entire breeding season. And then just a few infectious causes. And again, I'll provide this slide. So this is from a review paper that I did that went through some of the causes of orchitis and epididymitis that I talked about earlier that we're looking for, and what kind of tests we go through and look for. So the biggest ones are that we want to consider are Brucella ovis, Corynebacterium pseudotuberculosis, and Trupperella are the ones that I've found to be most common. And so orchitis, again, there can be some traumatic causes if they got kicked or something like that that caused the testicle to become inflamed. So that's what orchitis means versus infection. So, and we just diagnose it with a simple exam, palpating it. Sometimes we might do cytology or culture of the semen if it's infectious. And so a lot of times hemicastration and antibiotics might need to be done, but it needs to be done soon to preserve fertility if it's only on one side. If it's both testicles, a lot of times you got to either take those testicles out, or if it's really bad, I've had to euthanize the animal before if they're really painful. And this is just showing this one had CL abscesses all throughout his testicles. So that's a pretty common cause. And then epididymitis, as I mentioned before, this is the most common one we think of in rams. We always want to make sure we're checking for B ovis, but we can see it in young males too. It can be transmitted from male to male through it's actually respiratory pathogens that will pass from male to male. And it's good prognosis if you catch it early. So it's bacterial. So if you start to see signs of it early, or if we do an exam and we see that he's got white blood cells in there, we can start him on antibiotics early and they tend to resolve quite well. If it's Brucella ovis, so if it's not this respiratory pathogens, if it's Brucella ovis, it's a callable offense always. So we always want to make sure we're testing for that in any ram that has an epididymitis. And if we've got older males and more chronic cases that like this one, he had a really large one, the lesions eventually will block sperm outflow. We'll get necrosis in the testicles just from the backflow of sperm not being able to come out through the epididymis. So that's when the prognosis is going to be really bad for those. And again, palpating, we can do ultrasonography too. You can see here that you can tell this is kind of reddened in appearance, and this is what it looked like on the ultrasound. So big and full of fluid, and this is what a normal epididymis would look like. And this is the end of the testicle right there. And again, treatment, if it's those opportunistic pathogens, it's going to be antibiotics. And if we need to, hemicastration, if it's unilateral. If it's bilateral, then usually there's not much you can do at that point if it's advanced, besides trying some antibiotics. And then if it's something like CL or brucellosis or chlamydophila, those are all organisms that if we culture those from the semen, we usually want to cull those. And so just in general for rams, since I wanted to just make sure we're talking about brucellosis, is always make sure that you buy rams that have been serologically tested negative. Keep any newly purchased rams separate until they've all been tested free. And before you put them onto your farm, either yourself or have a vet come out and palpate them and make sure that there's no evidence of epididymitis before the breeding season. And again, always cull your B ovis positive rams. You don't want to keep those in the herd. And then just because I talked about diagnostic screening, these are some of the common things that you as a producer, if you're buying one, you might request from the seller to test before they come to your farm, or someone might request from you if you're selling the males. So things like that, CL bacteria, which is the Corynebacterium pseudotuberculosis, Johne's disease, which is Mycobacterium paratuberculosis, CAE, and OPP. So these three tend to come in biosecurity panels frequently. So Sage Lab and Wattle both do a specific biosecurity panel that covers all three of these. Sage Lab, I think, also does Q fever in their panel. So depending if you think that that's a concern in yours. And then again, Brucella ovis, you can usually add that on separate. And then I put semen culture in here, question mark. We're usually not doing it unless we've got any indication to, like there's disease in the testicle or the epididymis, and we're trying to isolate the organism. Okay, so I think we've got one more poll question.
Yes. There you go.
So, what pathology should be tested for in a ram with an enlarged epididymis? It seems like I honed in on that well enough for the majority of you. Okay. Yeah, so the majority of you got it. That it's the Brucella ovis. So anytime there's a ram with an enlarged epididymis. So the rest of those aren't really linked with that at all. So that's what we've got. Okay. Um, and then I just have kind of, I think this should be the last slide, heritability considerations. So, I already mentioned with the cryptorchidism. So there's certain things. So things like that persistent frenulum that where they can't exteriorize their penis, unilateral cryptorchidism, scrotal hernia. So a lot of those you can fix and breed them. But the question is, do you want to? So are those genes that you want to keep on in your herd or flock? So that's always something to keep in mind. Hoof health. So there's some things like corkscrew claws that cause them to be more prone to having issues with lameness. And, do you like having to continuously trim hooves like that? I don't. I mean, we do, but I don't necessarily like doing it for those really poor conformations. So selecting for hoof health can be helpful. Selecting for parasite resistance can be really useful. We've got a ram testation here at Virginia that they test for certain growth traits, but they also test for parasite resistance. And this is big in our fight against that barber pole worm with all the deworming resistance we have going on. And again, looking for different production traits. And with your sheep, there's a lot of big push for doing scrapie susceptibility tests. So doing codon testing to select against animals. We're lucky where we almost have scrapie, knock on wood, eradicated in the US. We're getting really close. So making sure we've got animals that aren't susceptible to getting it. So, and this is just kind of a little funny thing here at the end. Um, and I think we're ready for questions.
Whew, you covered a lot today, Dr. Stewart.
Yeah.
Covered a lot today.
That's a lot of information. Yeah.
I've got a bunch of questions written here, but I don't think we're going to get to them all. So I will try to get to things that I think will be most important to everybody. So one of the big ones that I saw, are there any dewormers that may affect semen quality?
No. So not that I know of. The only thing that I know that affects semen quality is something like dexamethasone. So if you're treating an animal for any kind of neuro disorders, dexamethasone does affect it. But as far as I know, there are no dewormers that affect it.
Gotcha. And then, so there were some questions about appropriate feed, how we're bulking up these sires before breeding season. Is there a certain protein we're targeting or energy needs we're targeting? And along with that, there were some concerns about creating some urinary calculi with trying to bulk them up. We're trying to balance the two.
Yeah, as far as specific feeds, I don't have anything in particular. I would just, if you've got a nutritionist, I would recommend working with them to figure out what the best source is for your area. But a good protein supplement is going to be something with good quality protein. And then yes, urinary calculi is definitely a concern. Less of a concern with our intact animals and less of a concern if we're doing more short-term feeding, but you can absolutely do pulse feed ammonium chloride to minimize the risk for that when you're trying to bulk them up.
Gotcha. And then there were some vaccination questions about sexually transmitted diseases. If we're vaccinating females, should we also be vaccinating the males on the farm?
That's usually not a bad idea. So if you're doing things like your Campylobacter and Chlamydophila pre-breeding vaccines, your males absolutely you do want to do CDT with them every year just to make sure that they're covered. But if you've had issues with those types of abortifacients, and most of those are late term abortion, and they're not usually coming from the male, and that's differing from what we see in cows, where there are a lot of venereally transmitted diseases. So we don't see a whole lot of diseases that are transmitted that way in small ruminants that we have vaccines for. So those are mostly late term, but it doesn't hurt to, cover your male too. It shouldn't hurt anything.
And then is it common for polled animals to have more cryptorchids?
Yes, because with the polled animals, with the polled intersex condition, cryptorchidism is associated with that too.
Okay. And then on to some of your testing, your Biovis testing. I know you talked a lot about what we're looking for there, but are there any organisms that can cause a false positive?
For the serology, I don't believe so, but I'm also not an immunologist. I feel like you're more likely with the serology, which is the blood screening test, you're more likely to get false negatives than false positives. And and then if you've got any animals that are clinical for it, I usually say that doing some sort of, if you either have semen that has white blood cells in it, or if you've got aspirates from testicles that have abscesses in them, doing a culture on that, you're going to be able to isolate the specific organism without necessarily getting a false positive. So that would be less likely too.
Gotcha. And then one of my personal favorites, can you culture frozen semen straws for diseases?
I would say no, because most of the semen is going to be frozen with an antibiotic in it. So we have done things like PCR to look for, because the PCR looks for little bits of the organism that might have broken off, but the culture would require that it be alive and that it actually grow on a plate. And if we've got antibiotics in there, it's going to prevent that. So I don't think culture is going to be the best, but depending on the organism that you're looking for, there might be a PCR. I would have to check with the labs. I've done more viral ones, but as far as the bacterial ones, I'm not sure if there's any good options.
Gotcha. And then you mentioned some of the traits around scabies and being able to test for scabies genetically. Is there any data on heritability or susceptibility to blue tongue or chronic wasting disease?
I don't know. I think because I have never had to deal with it much. I don't know if anybody's done that work, so I haven't looked into it. But that's a great question.
That is a great question. And then a couple other thoughts. So we've got somebody talking about how would you suggest preparing a buck for sperm collection, talking about for frozen straws. Would you give any vitamins or minerals or do a clean out? And alongside of that, there was someone earlier that was asking for practical suggestions on how to get those scrotal circumferences and do those male examinations on unwilling subjects.
What, Brudicane? Is that what we call it when you just manhandle them? That's usually what we have to do. There are nice, at the RAM test station, we've used these really nice tilt tables to get the males into, to flip them on their side so that we can do our examination with them. So if there might be like a facility that you can get them into, for collection, I have had to sedate the occasional male if I'm collecting them with electroejaculation, and we just simply cannot handle them if we do not have any type of facility. But as far as preparing them for breeding, really just having good nutrition, I would say no to kind of clearing them out, because you don't want to affect too much of their their sperm output by having them, if you're talking about turning them out with a female or something like that. I wouldn't want to affect too much of the output. So usually you don't have, and I guess it depends if you're coming straight out of, and the non-breeding season, then it might be good to let him go breed females for a couple of weeks and then um submit him for semen collection. But if we're just kind of in the middle of the season, I would say there's probably little prep you can do, making sure that he is remaining a good body condition, and things like making, if you're in a selenium deficient area, making sure he, gets a Bosey shot every once in a while, and just of good, that he's just healthy is the most important thing, I would say. The body can do the rest.
And I know we're 5 minutes over, but my very favorite question of the day, because this is our last class, and we've got a 3-week break before we come back. Is there a recommended reading list or websites that students can visit during the 3-week break
No.
for further reading?
Oh.
Yeah.
Well, the Merck Veterinary Manual, I wrote a chapter in that, so that's a pretty good one, that you've got free access to. Otherwise, any type of if you are looking up these topics, any article that has come from an extension program, I feel have usually been very good quality, if it's covering the topic that you're interested in reviewing.
And I'm going to put a plug out there. If you do a Google advanced search and put in whatever topic you want, and then scroll down the page just a little bit and type in .edu, it will only come from university sources. So just a little bit to help you filter through some of those Google searches. Dr. Salinas, I think we're caught up.
Yeah, I think this was great, everything, and just I was thinking in foundation science, also foundation science. I don't know. I was looking for the link. They have like a interaction AI option over there that they analyze all the fact sheets from extension universities. So it's a way to be asking directly to them. So I will be sharing that through an email, so the people may be looking specifically. Yeah, because in the internet you will be looking for many different options about reproduction during these 3 weeks of vacation. People will be very busy with many celebrations anyway, but I think it's good to start talking about artificial intelligence. So not only artificial insemination. So and it's important to be talking about that and how it's a trusted way to be doing. So I will be sharing about that. But yeah, we are going to have other 2 talks next year from Dr. Stewart. So you are so great, and so we thank you very much about having you with us. And we would like to have for many other talks, but we know that you're busy, and but you have a lot of things to be sharing with us. Thank you for the people also, and I will say, okay, Merry Christmas and have a wonderful time for holidays for everybody.
Sounds great.
Thank you.
Bye, guys.
Thank you.